Hey guys, welcome to another lecture. This lecture is on general pharmacology for the EMT. So I'm going to start off with some terminology for pharmacology. The first word I'm going to talk about is indication or indications. And an indication is the reason for giving a drug. For example, chest pain. So if you think of a drug like aspirin, aspirin is a drug that we give. Indications for aspirin for the EMT include chest pain. That's cardiac in nature, so cardiac chest pain. Now, is it the only indication for aspirin? Well, no. There are some people who take aspirin for pain. And while we don't give it to treat the pain, we actually give it because it's a platelet aggregation inhibitor. But another indication for aspirin is pain. When we talk about albuterol, that's another drug you guys are going to use, albuterol. The indications for albuterol are going to be wheezing, asthma or acute asthma exacerbation, and COPD or COPD exacerbation actually. So that's an indication. An indication is the reason that you're giving a drug or performing a treatment. A contraindication is something that prevents the use of a medication, basically a reason not to treat or not to give a medication. And that's a contraindication. For example, a reason not to give aspirin to somebody is that they're allergic to it. If somebody has an allergy to aspirin, then you don't give it. That's a contraindication. The next term is dose. The dose is the amount of a drug that's to be administered at one time, and it's usually ordered in grams, or some portion of a gram, like a milligram. So example, 5 milligrams. Aspirin is 324 milligrams, usually, if we're using the chewable kind. The mechanism of action is how a drug actually works. So aspirin, for example, blocks a particular chemical called cyclooxygenase, which is abbreviated COX. So it is a cyclooxygenase inhibitor. This does two things. It decreases pain, and it also happens to decrease platelet aggregation. So, in giving a patient aspirin for chest pain, we actually use the platelet aggregation mechanism to help them because it prevents a clot from becoming any worse. So that is the mechanism of action. And that's what the concept of mechanism of action is. The effects are the desired results of administration of a medication. So, for example, you give aspirin. The expected effects are decrease in pain and a decrease in platelet aggregation. Aggregation. The side effects are the effects that are not desired and that occur in addition to the desired therapeutic effects. So one side effect of aspirin is that it increases the stomach acidity and can eventually cause ulcers in the stomach. That would be a side effect. So I'm going to talk about medication names. So the chemical name is that big, long, ugly name that chemists like, and it actually describes the drug's chemical structure. If you know all the rules about chemical names, you can actually take and draw out the atomic structure of the chemical based on the chemical name. So here's a chemical name, 1,2,3-propane triol trinitrate. The generic name reflects the chemical's name but in a much shorter form, nitroglycerin tablets. And there are some rules for how they come up with these as well, but not always. The next name is the trade name. So this is the name that the actual manufacturer picks, and they use it to market the drug, nitrostat. Some other examples, Could be like Claritin. Could be Viagra. Let's see, Zithromax. That's a pretty popular antibiotic. Most of us know it now as azithromycin, but azithromycin is the generic name. All right. And then the last one is the official name, and the official name is what is actually used and registered in the U.S. Pharmacopoeia. The U.S. Pharmacopoeia is like the big drug reference book in the U.S. So it's basically all U.S. approved drugs, medications. So the example is nitroglycerin tablets, USP, and the USP says that it's the official name.